bulging disc is where the nucleus pulposa, or that material inside the disc, is starting to bulge backwards. A disc is like a jelly donut. We have the fluid in the middle that's a massive shock absorber, and we have this fibrous layer on the outside that's containing that fluid. Well, over time and damage, that disc can start migrating or moving backwards, either straight towards the spinal cord or to where the nerve root exits. If we have a little bit of a bulge, you'll start to feel that pain and discomfort from that stretch and tearing on the fibers on the back of the disc. If it really goes all the way through and extrudes backwards, now we have disc material that's outside that disc and up by that spinal cord or the nerve root with it. Now, both these conditions are very treatable in a chiropractic office if you have the right equipment. That just manually adjusting these joints probably are not your best option. Better treatments are going to find ways to increase blood flow to that disc, allow it to heal and repair better and faster. We have treatments such as traditional heat, ice, electric, but more importantly, a roller or intersegmental traction table is going to take the joints, rock them up and down, breaking up some of those pain cycles so that you feel better. It's going to increase joint motion so that it'll block the pain to the brain. We'll use decompression therapy, which pulls the joints apart. That pulling apart increases blood flow to that disc. The more blood flow to the disc, the faster healing can happen. It'll also help get that disc material, if it extruded back out, hopefully pull over away from that nerve root so you'll have less pain discomfort down that leg. We'll probably use Flexion Distraction, which is a table that stretches and bends in half to create more motion and movement at that injured area. We'll combine that with other treatments like cold laser or low-level laser therapy to decrease that inflammation and pain around that low back. Different exercises and stretches are going to depend on location and where's your weakness at. Some patients will do better with more of a flexion series of exercises, whereas others with an extension or McKenzie exercises. And if we can reposition to help block that pain, we'll have a variety of tools you can do at home when you're hurting to lay, tip back, get in the backside of that disc and relieve some of your daily pain. We might combine this with treatment outside the office, such as a pain management physician. See if they can help with decreasing that joint pain from either local cortisone injections or joint injections to nerve ablations to other advanced techniques to block your daily pain, while the chiropractic and physical therapy treatments have a chance to help and repair. We're going to talk about things you can and can't do, find ways to avoid irritating and aggravating that condition. So really, treatment for a disc bulge or disc herniation is a combination of many types of treatment. It's just not one thing. No one treatment is going to solve your problem. It's getting blood flow to the area, get the area to heal, get it to repair like it should, and then find ways to strengthen and stabilize the spine so you don't keep shearing that disc and re-blowing it again in the future.